That's fantastic, because that's been always a rub in the industry, right? Is to have those qualifications so that when you open your mouth, you exactly know what you're talking about.
Yeah,
That's
exactly. And
huge.
then you get taken seriously.
As far as LinkedIn goes, and I've seen you all over LinkedIn. It's like multiple posts per day that I see sometimes, and it's fantastic. So my curiosity kicked in. Number one, it seems like you have a huge passion to educate people as well, with what I've seen, commercials, education events that you put on, educational posts and things like that, even some how-to posts, if I remember right.
Yep.
And then your exercise. I like your exercise charts you throw up there every now and then. But I was just looking at that, and how far away do you get your patients from? Because LinkedIn is all over. So do you have a focus right in your city, or where do they come from as a result of LinkedIn?
Usually with LinkedIn, it's not so much getting the patients themselves, but it's getting referrals from other people who see those and then refer
Right.
them in. And we might get a patient, especially if it's from a referral from an attorney or another doctor, we might get them as far as an hour away. And it really just depends. But what's nice about that is when we put it on LinkedIn, then we can also allow people to share that content through other social media like Facebook or things like that as well. So we can cross platform.
No, that's fantastic, because that way they're coming to you for your expertise, and they see the value in that. And there's value in finding the right chiropractor that might not be the closest one to them. And I'm
Yeah.
sure you see that too.
Yeah, and that's what's been really interesting in the last, I'd say, 2 years. We've had people that I had one person come in from 3 hours away because while they knew they weren't going to be able to get treated, they wanted the initial exam and diagnoses so they could know what's going on. And then I could write a plan that they could then take to a local doc. And that was very valuable for them. And we were able to identify things that just hadn't been looked at before.